When people hear the phrase gender-affirming care, most tend to picture something extreme. Hospitals, surgeries, hormones, big, permanent decisions. But that picture skips over a whole lot of importance. Because most gender-affirming care doesn't happen in a clinic at all. It happens at home, at school, in hair salons, in everyday conversations. And most of it isn't medical. I already discussed the parts people tend to focus on. So now let's slow this down more and discuss what most care actually is. Because the reality is a lot simpler than people think. When doctors and psychologists use the word care, they don't just mean procedures. Care can simply mean support. It can mean reducing stress, improving mental health, or just helping someone function safely in daily life. So, gender affirming care doesn't automatically mean medicine. It just means helping someone live as their gender in a way that lowers harm. Sometimes that's medical, but most often it's social. And that difference changes everything. There's a term professionals use for this. It's called social transition. And it's exactly what it sounds like. Not changing your body, just changing how you move through the world. Things like using a different name, trying new pronouns, getting a haircut, wearing different clothes, asking teachers or friends to use the right words, and talking with a counselor. That's it. No prescriptions, no surgery, no medical risk. Just everyday life adjustments. And here's why that's important. Social transition is completely reversible. If someone tries a name and doesn't like it, they change it back. If they experiment with new clothes and they don't like it, they switch again. If their understanding of themselves evolves, nothing permanent has happened. Because nothing medical has happened. It's exploration, not commitment. It's closer to trying out a new hairstyle than making a lifelong decision. And for a lot of people, that simple fact lowers the temperature almost immediately. So why do doctors call this care at all? Because mental health is health. And decades of research show something very consistent. When trans people, especially kids, are supported socially, their anxiety drops, their depression drops, their risk of self-harm drops. Support itself reduces harm. So from a clinical perspective, letting someone safely be themselves isn't political, it's preventative care. It's the same logic as therapy or family counseling. You reduce stress before it becomes a crisis. And when kids are involved, this is more important because kids are usually where fear gets focused. So let's be very literal about what care looks like for kids. For children, it's overwhelmingly social only. No hormones or surgeries. Organizations like the World Professional Association for Transgender Health, the American Academy of Pediatrics, and the Endocrine Society all describe early support as psychological and social first, which means parents listening, teachers using the right name, maybe a new haircut, different clothes, a therapist to talk through the feelings. That's what the treatment plan usually looks like. Not a hospital, conversation. And when you picture it that way, it feels a lot less scary because it's just support. I think a lot of the tension around this topic comes from a mismatch in images. People imagine kids being rushed into surgery, but the reality is years of slow social exploration first. People imagine permanent medicalization, but most early steps are reversible and low stakes. People imagine experimental treatments, but often it's literally just call me this name instead. When you pan out, the gap between the fear and the reality is huge, and most arguments happen inside that gap. So when we talk about gender affirming care, it helps to be precise. Because if we only picture the most medical possibilities, we miss what most people are actually receiving, which is respect, support, room to grow, and room to figure out themselves safely. Most of the time, gender affirming care isn't surgery, it isn't hormones, it isn't anything dramatic at all. It's listening, it's language, it's everyday life. And calling that dangerous medicine doesn't match reality. It's not a hospital story, it's a human one.